As value-based healthcare reforms are being implemented and considered in Australia, how do we ensure these new models of care strengthen, not weaken health equity? Disadvantage caused by inequitable socio-economic factors, such as low income or employment status, contribute to poor health outcomes for many Australians. In 2018, the Australian Institute of Health and Welfare estimated that if all Australians experienced the same level of disease as the wealthiest people in our nation, our total burden of disease could be reduced by 1/5. Value in healthcare has been defined as the health outcomes that matter to patients relative to the resources or costs required. Using this as a frame of reference, we must expand on this definition and consider a greater range of value-based healthcare outcomes to ensure that the promotion of value does not impede health equity. Value-based healthcare reforms should protect the interests of vulnerable populations, particularly those who are negatively impacted by social determinants. In our issues brief, Can Value-Based Healthcare Support Equity?, we put forward 5 recommendations for implementing equitable, value-based healthcare reforms. Firstly, governments and public-funded health organisations should establish cross-sector partnerships. Funding reforms should consider arrangements that strengthen incentives for improving health equity. Commissioning decisions should be informed by data that identifies health disparities. Data linkage across community, health and social services should be prioritised. Finally, value at both an individual level and public level must be prioritised as new technologies and treatments are funded. If you would like to know more, please read the Deeble Institute for Health Policy Research Issues Brief, Can Value-Based Healthcare Support Health Equity? The brief can be accessed on the AHHA website under the Deeble Institute for Health Policy Research section, or by contacting AHHA.